I'm Anne Mosley, and I'm an Associate Professor at the Institute for Musculoskeletal Health at the University of Sydney. And I'm pleased to introduce Vicki Goodwin, who is an Associate Professor in Ageing and Rehabilitation at the University of Exeter. Vicki's the lead author of the rapid review entitled Rehabilitation to Enable Recovery from COVID-19, and she joins me today to discuss the review. So welcome, Vicki.
Thank you.
Could you just tell us a little bit about the motivation behind doing the review?
Back in sort of March last year, our lives completely turned on their heads. And as a physiotherapist, I was wanting to help my clinical colleagues who were working on the front line. And they were telling us they were not sure quite how to manage people with COVID-19 because this was new. Was there anything that we could do from a research perspective to help them? And then a couple of weeks later in April 2020, we ran a tweet chat with the PhysioTalk platform to really try and understand what it is that they needed in terms of information to maybe help them manage their patients with COVID-19. Alongside that, there was also systematic reviews and evidence briefings and guidance and recommendations around how to manage the sort of respiratory physiotherapy issues. But we wanted to look at a more broader sort of recovery and rehabilitation process that went beyond just respiratory physiotherapy.
Could you tell us a little bit about why you chose to do a rapid review?
Having a systematic process on identifying the literature was really important, particularly because a lot of non-systematic reviews were coming out. But we needed something timely. It wasn't something that we could spend a year or two sort of pulling together. We needed something as soon as possible. And one of my evidence synthesis colleagues sort of suggested to have a look at Cochrane. They'd developed a rapid review group and they'd started developing some interim guidelines, which have since been published by Garrity and colleagues. And actually that fit exactly what we wanted to do, that it actually balanced in the systematic and rigorous methods alongside being able to do something in a slightly more timely fashion than would necessarily be possible with a full-on systematic review.
Many PEDro users are very used to reading systematic reviews. Could you just tell us a few of the differences between a rapid review and a systematic review?
Yeah, so there's many similarities. Both use these rigorous methods, but because of the time issue, you might have to make some decisions and some explicit decisions on where you maybe can gain some time in doing your review without losing too much of the quality of the review. So areas that we thought about were looking at decisions around what language you include or particular dates of the searches. So you might limit those somewhat to save a little bit of time. You also might limit the databases that you searched in. So it might not be quite as comprehensive as you would traditionally do. You might not search in the grey literature. And then in terms of screening, we did 25% independent double screening. And then for the remaining 75%, one person did all the screening and then a second person checked all the exclusions. And then in terms of the data extraction, one person extracted and a second person did all the checking. One of the things that was really important, as is with all systematic reviews, is having a publicly accessible protocol. So that, again, was really important. So we registered that with the Open Science framework.
Fantastic. And could you tell us a few of the main findings from your review?
So it was much bigger than we expected. We found 24 systematic reviews, 11 randomized control trials that hadn't been included in any of those reviews. And we also found 8 qualitative studies. But overall, we found that exercise, early mobilisation and multi-component programmes appeared to be effective at helping people recover from severe respiratory illness, so that they were requiring intensive or critical care to manage their respiratory illness. For example, the EPICC study that was conducted by Wright et al., they reported a mean difference of 9.7 points on the functional independence measure in favour of a 90-minute exercise programme that was conducted when people were in intensive care, compared with a 30-minute more general rehab programme. But actually what we found were some massive gaps in the evidence. So we were interested in the whole sort of pathway, right from intensive care step down into a more general hospital care, but also when people went home. And actually there was a real paucity of evidence in the step down, but also in the sort of more home-based rehabilitation approach.
What's your take on the generalizability of your review?
For people who have severe respiratory illness, those were the sorts of people with COVID-19 who were requiring intensive care. They had respiratory failure, severe pneumonia. So they were having those severe respiratory symptoms. So we were able to use that as a basis. So I do think it is generalizable to those people who needed intensive care, but wouldn't necessarily be applicable to those who didn't go into hospital, who had different symptoms.
Thanks so much for discussing your review with me, and we look forward to indexing more of your research in PEDro. Thank you.
Thank you very much.